What environmental controls prevent TB in healthcare settings? Imagine walking into a hospital where every effort is made to keep you safe from infectious diseases like tuberculosis. One of the most important ways they do this is through environmental controls that help prevent the spread of TB. These controls focus on managing the air you breathe, since tuberculosis spreads through tiny airborne particles called droplet nuclei that contain the bacteria. When someone with active TB coughs or sneezes, these particles can float in the air and infect others if not properly managed. The first line of defense involves primary environmental controls. Local exhaust ventilation is used to capture infectious particles right at the source, like near a patient who is coughing. Devices such as hoods or booths can trap the contaminated air before it spreads into the room. General ventilation then comes into play by increasing fresh air flow into the space and exhausting the contaminated air outside. This process dilutes the concentration of bacteria in the air, making it less likely for someone to breathe in enough bacteria to become infected. Secondary controls are also vital. Airborne infection isolation rooms are specially designed rooms with controlled airflow patterns. These rooms keep contaminated air contained and prevent it from escaping into other parts of the healthcare facility. Inside these rooms, high-efficiency particulate air filters are used to remove infectious particles from the air. These filters are very effective at trapping tiny bacteria and are often used in combination with ultraviolet germicidal irradiation, which uses ultraviolet light to kill or inactivate TB bacteria as the air circulates. Supporting these measures are protocols for healthcare workers. They are trained to use respiratory protection, such as properly fitted respirators, especially during procedures that generate aerosols. Patients with infectious TB are encouraged to practice cough etiquette and wear surgical masks to reduce droplet spread. Signage and supplies like masks help promote respiratory hygiene among staff and patients alike. All these environmental controls work together as part of a comprehensive infection control plan. They aim to reduce the source of infection, dilute and remove contaminated air, prevent the spread to other areas, and disinfect the air within healthcare settings. Implementing these measures according to guidelines from health authorities is essential to protect everyone in the facility. Always remember, these controls are most effective when tailored to each healthcare environment and combined with ongoing risk assessments and collaboration with public health agencies. For personalized advice or specific concerns, consulting healthcare professionals is always the best step.